Okay, the introduction of the F wave. The first one is F wave are low amplitude response produced by antidromic activation of motor neuron following distant electrical stimulation of motor nerve fiber. And then meaningful analysis of F wave required an appreciation of this characteristic of F wave as well as an understanding of the physiology. The second one is F wave are one of the most frequently used study in clinical neurophysiology. And much of the controversy surrounding the use of F wave relate to a failure to adequately consider the requirement of F wave analysis. The disease that's suitable for the test. I have two. The first one is Guillain-Barré syndrome. The second one is cervical dystonia. The Guillain-Barré syndrome. The first one, I want to talk that they are foremost cause of acute generalized peripheral neuropathic weakness. Second, the nerve conduction study are the most important ancillary diagnostic test. The GBS is an acute paralysis that starts with numbness, paresthesia in the distant part, and it's rapidly followed by ascending paralysis of the four extremities. And then I want to tambah kata that the motor nerve damage usually start from the lower limb and spread progressively to the upper limb, body, and central nervous system.
EMG electrode should be placed at a proper location and its orientation across the muscle is important. The surface EMG electrodes should be placed between the motor unit and the tendinous insertion of the muscle along the longitudinal midline of the muscle. The distance between the center of the electrodes or detecting surface should only be 1 to 2 cm. The longitudinal axis of the electrodes which pass through both detecting surface should be parallel to the length of the muscle fibers. The EMG detecting surface should be placed in between the motor unit and the tendon insertion of the muscle.
Procedure F wave for EMG. Okay, first we need to set up the computer to EMG apps before testing to patients. Second, let the patient lie or sit down on the chair or bed. Third, place the electrode on the patient's hand or leg. For step 4, place the black electrode active on the thumb muscle. And then place the red electrode reference at the thumb end. 6. For ground, we should put the green electrode on the back of the palm. Step 8. Place the simulator on one median nerve location as shown below. Step 9. Set current simulator intensity at 2 mA until the current suitable for patient skin. Step 10. Confirm the nerve position and click F continuous to send 20 stimulate pulse to the patient. Before click to F continuous, place the simulation electrode onto the nerve and click single to verify the location of the nerve to stimulate.
The first one is the graph displayed after the red vertical line is F wave graph. So the second one is value of F wave latency. Number 3 is F wave peak to peak value. Number 4 is F wave or M wave amplitude value. So the fifth is input the distance between the stimulation point and record point. From that, the condition speed value will be calculated automatically. So the last one is the interface displays the overlapping F wave with the measuring lines. These results happen when the EMG electrode give 3.5 milliampere current to the nerve. The anterior horn cells reflect, which is give the subject thumb to make a movement itself. So the simplest example is like the function of a pacemaker to the heart when it replaces SE node to sense electrical impulses. So the less time the nerve takes to reflect, the better the integration level of the muscles. And the lowest reading of F wave should not exceed 1.0 milliseconds.